Coming up on Pathways, they are the breath behind the recovery.
I remember we were shadowing one day and our patient was crashing, and then all of a sudden this person came in with this machine, put it on the patient. The patient turned around. That person just came, saved the day, and left. And I was like, what was that and who was that? They're like, oh, that was respiratory therapy.
When every breath counts, respiratory therapists step in with skill, urgency, and heart. From emergency rooms to intensive care units, they are the steady hands helping patients breathe easier.
And we're back with another episode of Pathways, part of Northern Light Health's Healthy, Happy, and Wise podcast series. I'm your host, Emily Tadlock, and today we're breathing easy with Jessica Breton. She is a respiratory therapist at Northern Light Mayo Hospital. Thanks for being on with me, Jessica.
Yeah, of course.
Okay, so first off, what is a respiratory therapist?
A respiratory therapist. We are specialized in cardiopulmonary. So we deal with a patient population that has breathing issues, anywhere from COPD to cystic fibrosis to pulmonary fibrosis. And we do deal a lot with also cardiac patients as well, because the heart and lungs do go together most of the time.
So in easy layman terms, people who are having trouble breathing,
yes,
see you.
Yes.
Okay. So respiratory therapists, I think we saw a lot more of them and heard a lot more about respiratory therapists during COVID. Yeah.
Yeah, for sure. Our profession has definitely grown since COVID. Even now, a lot of people don't know what respiratory therapists are, but I do think that we've come out of the woodworks since the COVID pandemic, since it was a respiratory pandemic.
Okay.
Yeah.
And, maybe talk a little bit about what you do specifically for those of us who fortunately haven't had to necessarily come in contact with a respiratory therapist for whatever reason, or unfortunately, if they get to know you like I have today. Tell us a little bit about exactly what you do and how you would help a patient.
Yeah, for sure. So, it's really a wide range. We work from, little bitty babies to, all the way to end of life. So we can do outpatient things. So we do the diagnostic test for COPD, asthma, the pulmonary function breathing test. So, that's not terrible when you come and see us for that.
Okay, yeah.
Or you could roll in the emergency department and we help, put a breathing tube in and put you on a life support machine, or a mechanical ventilator is the medical term. But, our day varies from, going to a birth to helping somebody transition to end of life.
Wow. That is a big range
Yes.
of helping patients.
Yes.
I wouldn't say that your days are identical.
No, not always.
Okay. So, typical day, you come in and what happens?
Yes. So here at Northern Light Mayo, we have a lot of outpatient procedures. So like today, I have, I believe, 5 pulmonary function tests that I do.
Okay.
So that's the breathing test that diagnose COPD, asthma. I just instruct them on how to breathe. We send the report to a lung doctor. They review it. And then I could get done a pulmonary function test and get called to the emergency department for a code blue, or to do a nebulizer on somebody that comes in a COPD exacerbation. So, it's hard to really say what I could be doing in any particular day.
Okay. Well, that makes things exciting.
Yes.
Okay. So to become a respiratory therapist, what did you have to do?
Yeah. So right now in New England or Northern Maine, I guess, it's an associate's degree. It's a 2-year program. There's a bunch of prereqs that you'll have to do before, and then you'll spend 2 years in your respiratory classes. South of here, in Boston, that kind of area, it's a bachelor's degree.
Okay.
But up in Maine, there's just 2 programs, one in Southern Maine at SMCC, and then there's one at KVCC in Kennebec Valley. Yep, in I believe it's Fairfield. So there's only 2 accredited programs in Maine for respiratory therapy currently, and those are both associates.
Okay.
Once you go south, a lot of them are bachelorette programs. That's what they're kind of, going towards now. So for me in particular, I went to SMCC, got my associates, and then I just went back online and got my bachelor's at Boise State University. So,
congratulations.
So you do have that option as well, which is nice.
Awesome.
Yeah.
So, and for those interested, there is different levels of respiratory therapy as well, right? Respiratory therapy 1 and 2 and
yeah. So Northern Light specifically, we have a clinical ladder. So you would start out as a respiratory therapist 1. And then the clinical ladder, you can build up to a respiratory therapist 3 for Northern Light. But also in the respiratory profession, you can also get specialty credentials. So you have your registered respiratory therapist once you pass both of your boards. So for myself, I went back and got my adult critical care specialty. So I have my RRT, BS, ACCS. So, and they have a bunch of different ones. You could do specialized in sleep labs, so do overnight sleep studies. You could do pulmonary function testing. You could do asthma education, neopeds, so babies, that kind of thing. So there's a wide range that you can do.
Okay. Yeah. That's really interesting. So for those people who are interested in, just kind of getting their foot in the door, we do have an Earn While You Learn program that we do at Northern Light Health in collaboration with Kennebec Valley Community College, KVCC, like you mentioned earlier, where they could work for Northern Light Health part-time, as it's different at each place, but typically something along the lines of a patient experience aide, and then do their schooling. So work part-time, go to school part-time, but maintain full-time hours and pay and benefits to become a respiratory therapist with Northern Light Health. So I think that's a really interesting way to help promote the profession.
Yeah, for sure. It's a great program. I wish that was around when I was doing it. So like you said, it's like a work to grow. So they'll be working alongside respiratory therapists. So it's great for when you're in school because you have respiratory therapists that can help you with homework, help you with study. It's just nice to have that resource and to kind of get your hands, dirty while you're still in school.
Yeah. Which is, I think, I don't know about a lot of other people, but for me, hands-on learning is really the best way that I learn. And I have a funny feeling that for people who are interested in this type of work, hands-on is going to be critical to really learning how to do the job.
Yes, for sure.
So how did you get into respiratory therapy?
Yeah. So in high school, I did a lot of college credits in high school, and we also were required when doing that to go to the vocational school. So I had to pick a program. So I did the CNA program, and I worked as a CNA all in high school.
Oh, okay.
And that's when I learned I did not want to be a nurse. I love my nurses out there, but I remember we were shadowing one day and our patient was crashing, and then all of a sudden this person came in with this machine, put it on the patient. The patient turned around, and that person just came, saved the day, and left. And I asked my nurse who I was shadowing, I was like, what was that and who was that? They're like, oh, that was respiratory therapy. They just started that patient on BiPAP. That's just what they do. They come in, save the day, and then leave. And I was like, that was kind of cool.
Some heroes wear capes. Some bring in machines to help people breathe. I love it. Yeah.
So that really exposed me, and I did job shadowing, and I fell in love with it. So here I am.
Wow.
Yeah.
So it's kind of neat too that you've experienced some different positions within the hospital to find out that respiratory therapy was the pathway, if you will. And just kind of toot my own horn for the name of the podcast, but it's neat that you got to explore different types of pathways that eventually led you to respiratory therapy.
Yeah, in my short career, it's been great. I mean, I started out at Eastern Maine, and I still work there per diem as a staff therapist, got lots of experience. And then I decided to join the travel bandwagon. So we do have the option as respiratory therapist. I traveled for about 2 years, worked in Boston for a year. That was a great experience. And then came back to here at Northern Light Mayo, my hometown, and took a manager position. So it's just crazy how much you can, grow in the profession as well.
That's awesome.
Yeah.
So, as you were just kind of mentioning, respiratory therapists are needed everywhere.
Mm-hmm.
Why in Northern Light Mayo Hospital? What is it, or even just Northern Light Health in general? What is it about working for Northern Light?
Yeah, Northern Light's been great to me ever since I started. Like I said, I've been in the Northern Light system for 6 years now. Eastern Maine is a great place to experience. Mayo always has had a special place in my heart because it's my hometown, it's my community.
Yeah.
So, and I know that we need respiratory therapists to have patients be safe and to make a difference. So, I wanted to make sure that this community and hospital had that available to them.
I love that.
Yeah.
What would you say is your favorite part of your job?
My favorite part, I love teaching. And we're always teaching as respiratory therapists with nursing, providers, like everybody. Because there's always something new to learn because we're a specialty. So we're kind of, turned to be the experts on, the lungs and breathing.
Okay.
So that's why I really like that part of it, is being specialized. And like I said, no day is the same. Could be a slow day, could be a busy day. You just never know.
Okay. Or you could be on a podcast.
Or you could be on a podcast.
So, what would you say to encourage other people to look at respiratory therapy as a possible career path?
Yeah, I would definitely encourage to job shadow because like I said, it's really a wide range of things we do. So it's really important to, kind of see what we do. It's more than giving breathing treatments. It's more than, running the mechanical ventilators. There's a lot of different little aspects that a lot of people aren't aware of. So it's good to just, get a good idea of like what it entails.
I think that's really important because I think I have fortunately been able to kind of follow you around today and see some of the different things that you guys actually do. I don't think people are really aware of it. If you are even generally aware of what a respiratory therapist is, you typically think hospital room, someone needing to be on a ventilator. That's the type of thing that you think of and associate with respiratory therapy. But there's so much stuff that you guys do to help diagnose breathing issues and help treat even.
Yeah, and manage for sure.
Yeah,
because like a lot of these people with COPD, I mean, that's not a curable disease. It's something you have to manage.
You've mentioned COPD a couple of times. Can you just
chronic obstructive pulmonary disease, and that's really common in this community. Actually, I think Piscataquis County is actually one of the highest rating for COPD patients.
Wow.
Yeah.
So it's not only is it critically important to just have respiratory therapists on staff, but especially for Maine and our communities and the people, especially in our rural areas like here.
Yes. So that's why this sponsorship, Learn and Grow program is a great way to get the profession out there and to get more helping hands for the state of Maine.
We talk about you, respiratory therapists, coming in and saving the day, but not every day can be easy, right? There's got to be challenges, just like any job.
Yes, for sure. Especially in, a lot of things that we do. Because like I said, we're dealing with, little babies and all the way to the elderly. And if respiratory is usually being called, it's usually not great. So it can be difficult, but I will never forget one of my preceptors always said, we're the calmest in the room when, stuff's not great. And it kind of sets the aura. And everybody kind of just looks to us, even though, we know what's happening in front of us. But it's just our job and, the team's job is just to make it, the most comfortable or do the best we can. And it is hard in the role that we do play. So, I mean, every day you might not save the day, but it's just a matter of doing the best you can and just remembering, why you're here and why you're doing it. And that's all you can do is show up and give it your best. So,
and I like that. It must give you some sort of fulfillment.
Yeah, for sure.
Yeah.
And like I said, that's the other thing. Like you could, help somebody transition to the end of life in the morning. And then, you kind of set the precedence for the day. And then, at 12 o'clock, you get called to go to a delivery of a beautiful, healthy, baby. So
there's definitely variety.
Yes.
And I think it's important that we talk about the good and the bad. I mean, this is your career. This is what you're going to be doing.
Yeah, for
and
sure.
hopefully loving. It sounds like you do.
Yes, for sure.
Loving the career that you do. So it's important, I think, to point out the good things and the not so great things.
Yeah.
Yeah.
But like you said, every job, kind of has that. But
it does. Yeah, absolutely.
Just remember why you're there.
Exactly. So when you started in your career, like think back a little bit, first day on the job as a respiratory therapist, that must have been nerve-wracking.
For sure, yeah.
But you're not just thrown into it. Like Northern Light Health has a really good mentor program to help get respiratory therapists acclimated to their jobs. Yeah.
Yes, 100%. So, like I said, I started at Eastern Maine. I believe they do like a 13-week orientation, and everybody's great. If you're not comfortable, you can get extended, but they really make sure that you're ready. They set you up for success for sure. And even after coming off orientation, you have the resources and the people to turn to. Here at Northern Light Mayo, we've been actually utilizing our mothership, Eastern Maine. So I've been taking both of my new grads to Eastern Maine for orientation. So they get exposed and experienced to more critical care patients, so they feel more comfortable being at a critical access hospital, which is super important. A lot of people think, working at a smaller hospital would be easy, but or at least in our role, it's not, because you don't have as many resources. But we do try to make sure that you're pretty well-rounded and, have everything that you need to, be the best and perform and give the best patients the best care.
I love that. And it's really cool that you're able to collaborate with the different types of hospitals.
Yeah, for sure.
Within our system, within the Northern Light Health system.
Yeah, respiratory is a small world. So it was great that I had, relations with the Eastern Maine crew, and I was able to, make connections, and they've been more than willing to help us, with orientations, and even have offered us to come over for skills day for our respiratory therapist here.
Oh, great.
So that's great. So that's awesome that Northern Light, we kind of, work as a system versus as in each individual hospital.
It sounds like there's a lot of support there.
Yes. Yep. And I've also supported CA Dean. We go up there and we'll do education. So we try to help, each department, all of our therapists over system wide, and not just therapists, even nursing, because CA Dean doesn't have a respiratory therapist, unfortunately, but our therapists will go up there and do education to make sure that nurses feel comfortable with all things respiratory.
Okay. Well, what about support for continuing to grow in your career?
Yeah. So there's definitely room to grow within your career in Northern Light. We have the clinical ladder, and as far as the support, when I went back for my bachelor's, they do offer tuition reimbursement, so that's really good, and flexible with schedules and that kind of thing, knowing that I was in school. So yeah, they've been supportive for sure.
That's great.
Yeah.
So this sounds like a career that you could start in and then flourish in.
Yeah, for sure.
Love that.
Yeah.
Thank you so much for being on with me today.
Yeah,
I've
of course.
Loved learning so much about your profession and what you do. And next thing you know, I'll come in with a cape, and maybe you can just run around into rooms with a cape on. Save the day.
Yes.
I like it.
Yes. So go to respiratory school, not nursing.
So take advantage of our respiratory therapy program anywhere in the state, and work at any of the Northern Light Health hospitals. There's plenty of places to work, but Northern Light Health, wink wink, is a pretty great place to be.
Yes.
Awesome. Thanks, Jessica.
You're welcome.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.